the HCT Intensification launch event marks the beginning of a series of activities that will contribute to the attainment of the goals of getting 1.3 million public servants to test and know their status, and each one of them to pursue 5 other amongst their family members and friends. There's no doubt that the public service has a crucial role to play in mitigating the impact of HIV and AIDS and TB as part of its overall focus on the health and well-being of its members and their dependents. Public Service Operational Plan was developed in 2010, setting a testing target of 49% of the approximately 1.3 million public service employees. That is 637,000 employees by the 31st of March 2011.
It is an honor to address you on this important occasion to discuss measures to intensify the voluntary HIV counseling and testing campaign within the public service. The launch of the various guidelines, as so eloquently delivered here through the lips of Minister Motsoaledi, marks another critical milestone in our response to the dual epidemics of HIV and TB. The successful implementation of the guidelines launched here today will go a long way towards the achievement of this objective. We are acutely aware of the fact that much more needs to be done to achieve many other objectives we have defined in the various strategic plans of the different departments, and we acknowledge the work that has been done so far. A number of problems have been identified, thus pointing to various systemic weaknesses pervasive across various departments which demand ongoing and consistent correction. Since the President launched the National HIV Counselling and Testing Campaign, over 20 million people have come forth to be screened and tested for various diseases. This campaign has indeed been successful. However, our goal is to ensure that people get tested and screened at least once a year, and therefore we must find ways of sustaining the momentum. Today, we are launching the intensification of the HCT campaign in the public sector to do just that. As such, it is crucial that the government, as the leading partner in the drive for universal HCT programs, lead by example. It is therefore important that we step up our campaigns and programs within the public sector, ensuring that each employee is encouraged to know their status, to support their relatives, to do the same, and to promote a healthy lifestyle. We must inculcate a healthy lifestyle through the force of example. Ladies and gentlemen, allow me to cite the statement of the National Development Plan by the National Planning Commission, and I quote, "A capable developmental state is an essential precondition for South Africa's development. Such a capable state cannot materialize by decree, nor can it be legislated or created through glossy strategic plans, conferences, seminars, meetings, and talk shops. A capable developmental state has to be built painstakingly, brick by brick, institution by institution, and can only be sustained and rejuvenated patiently over time. This will require strong and capable leadership. It will require sound policies, a skilled workforce, clear lines of accountability, appropriate systems, and consistent and efficient implementation," close quote. In essence, This means that people and human resources are central to the successful implementation of the National Development Plan, but more importantly, that the public service and its employees are a critical component of the state's capabilities. A healthy, productive, and committed public service is thus critical to the overall success of government in the attainment of its broad development agenda. Thus, the intensification of the HIV counseling and testing campaign is at once a gateway to the implementation of the new guidelines and initiating a culture of taking responsibility for our health and wellness. The National Strategic Plan for HIV, TB, and STIs has defined this intervention as one of the priorities in our response. We want to encourage other sectors to follow this lead and extend services to their employees and the communities in which they work. From all these interventions, we are confident that a future of zero new infections, zero discrimination, zero AIDS-related deaths, and zero new infections due to vertical transmission is within reach. Ladies and gentlemen, with these few words, I wish to thank you for leading and directing this program from this morning, and I congratulate those who have taken the opportunity to use these services and now know their health status. I wish to encourage and urge those who have yet to take this step to do so in order to maximize the benefits of treatment, care, and support. Let us continue to support and encourage one another to live healthy lives. Let us lead by example and work together to create and sustain a public service that we can all be proud of. And I thank you for your attention.